Cancer Cervix Act Now for a Better Tomorrow. Make in India. Dr. Hema Divakar, in conversation with Dr. Sarjan Shah from Green Array. MBBS and MD Path from BVDUMC, Pune. Director at Green Array Genomics Lab. Director at Green Cross Laboratory. Director at DSIR Accredited ADPL Research, Pune. QM and TM for Green Cross Laboratory. Cytogenetics training under Dr. Hema Purandare. Molecular genetics training at various institutes. Special interest in molecular diagnostics and precision medicine. Published research papers on molecular diagnostics in HPV, NBS, and microbiome. Internal auditor for NABL for various labs.
With just about everything being available at your doorstep, blink it and it arrives. Similarly, can we get the preventive healthcare right on to every girl, every woman, everywhere, every time? With that focus, I have spoken a lot about two leading cancers in our country, the breast cancer and the cervical cancer. And I have also told you about something very special that the Green Array Lab, with its innovator, Dr. Sarjan Shah, has done in this space. So now I have the pleasure of bringing onto the screen none other than the man himself, Dr. Sarjan Shah. Welcome to the FemTech360 Podcast, Sarjan. And from all OBGYNs across the country who have had a glimpse of the wonderful work that the Green Array Lab is doing, we first like to offer our heartiest congratulations to you and your team. And thank you very much for exploring more and more, as we say, from microscope to the mobile lab. We have to percolate everywhere, taking healthcare to where people are rather than moving people to the healthcare settings. So in that context, as I have already said, cervical cancer is something that we want to detect early. And in this space, the innovation that you have done, which gives us a lot of clarity with the detailed reporting of which is the type of HPV which is detected, non-detected, etc., unlike the cluster reports. Tell me what went on in your mind before you hit upon something that you could do to facilitate our understanding of what's happening to our patients. Sarjan.
Hi, thank you so much for this opportunity, ma'am. And thank you for the community to give us the support that we could finish more than 10,000 HPV testing in a very short period of time across many regions.
Excellent.
So, as all of us are aware, cervical cancer is the fourth highest cancer in the world. And 2020 global consensus by WHO said that 6 lakh new cases were reported and about 3.5 lakh deaths occurred because of cervical cancer. When we come back to India, one in 53 women will develop cervical cancer in India, and every 8 minutes there is a lady dying because of cervical cancer in India. Now, these are foxy numbers and these are huge numbers. I mean, every
Absolutely.
8 minutes, that hits us.
Yeah.
Sarjan,
it hits us, but are we doing enough to kill it
absolutely,
before it kills us?
absolutely. Yes. No, we are not doing enough. We need policies, universal programs for this. And that is exactly how, Green Array started, that we wanted to focus on oncology, but we wanted to focus on preventive rather than diagnostic or treating, because it was getting diagnosed by one or the other reasons. But was it too late? I mean, our 5-year survival in India is about 38 to 53% for cervical cancer. That is too low. Science is progressing so much.
Advanced cancers are detected more often than the early detection.
Absolutely. So here, by just detecting HPV, we can know about a cancer 2-3 years before. We need not wait for a CIN 1, 2, 3 or a precancerous lesion to happen. When we can prevent it early, then why not?
Yeah.
So this is what pushed us into making this HPV testing.
Sarjan, let me just ask you to reflect on the numbers in your own laboratory. Okay.
Yeah.
Because As clinicians, we know that if we have to detect cervical cancer early, one option is visual inspection, which is now last on our list. The second option, always available, was pap smear. And now the new entrant is the HPV testing.
Yes, yes.
So, in the last maybe 10 years ago, when only pap smear was being done,
Yeah.
just give me a ballpark number of how many samples would arrive in your clinic, month after month or for a whole year. Was
So
it,
when I was doing only pathology before this genetic lab, so we used to get very few samples of pap smear, very few. I mean, I can just count it. I mean, it was the easiest sample to be taken, then biopsy. But then monthly we were hardly doing 100 tests, not
Hmm.
more than that. So that was very low. First of all, there was a lot of issues regarding who will go into doing pap smear, and women willing to go to a gynecologist for preventive health checkup was unheard of.
Yes. Hmm.
That it was never been in that program of screening somebody. There was no system of screening 10 years back.
Hmm.
So whatever we used to get after some symptoms have come, or some bleeding has happened, something has happened, and doctor wants to check
So did
whether.
your lab sometimes they request you to join hands with either Rotary or some any other organization who used to do these massive camps, pap
Yes,
smear camps lagao. You know?
right,
So,
right.
so do you think the women there were willing, and then with pap smears could be done with some ease?
No, not actually. We would think that it's a free camp, and thousands will come to these camps, but it was not happening
Hmm.
because women were conscious. There were quite a few myths and fears were attached to these testing. And top of all, even today, women don't know whether cervical cancer is related to HPV and LBC and PAP,
Yeah.
and whether it is preventable or not.
Hmm. Hmm.
So awareness is the biggest key. What I feel that people like you and me are generating
Hmm.
now in India today. Then quite a few people are now aware that there is something called HPV testing, something called LBC, something called PAP. One needs to do it repeatedly. It has come into guidelines,
Hmm.
but this was not the case 10 years back. It was a
Right.
very glim
Yeah,
story.
thank you for this real world,
Yes, yes.
insight. Because just leave alone the cost for a moment, but the ease of doing the test. Do you
Yeah.
think there's a huge difference between pap smear and taking a self-sampling with the cervical
Very true,
HPV test?
absolutely. Because taking an LBC smear itself
Hmm.
or a pap smear was, a job of a trained person.
Yes.
He'll do the testing, where to take it, when to take it. Just by putting a colposcope, you're
Hmm.
removing those dysplastic cells.
Yeah.
So you're not getting enough cells. So now with self-sampling kit, a person needs to take a vaginal sample and at the ease of their home, go to your home, be safe in a safe environment. They can take these samples. Need not go to a specifically take an appointment, go to a doctor. We know how many, I mean, you all have such a huge workload, and in that workload to fit these patients. So, a lot of things have changed with self sampling.
Do you think that semi-skilled person, paramedical person doing this sampling,
Yeah,
because even self-sampling, we just keep it one step ahead.
yeah,
Okay, even those in the camp setting, suppose 100 women for a camp, two may have agreed for pap smear, but at
yeah.
least 20 will definitely agree for a so
Self sampling.
because there is a comfort level and ease without hanging the legs up and having a light and
Yes,
an instrument.
absolutely. Absolutely, because this social issue still stays with us. I mean, no matter how much we have progressed, but going to a camp and giving a cervical sample is still a problem for women. So when they can avail this same at their own comfort, this has a huge role to play in future.
Sure. I think, Sarjan, from your own institute and from Asmita Foundation and all your allied collaborators and partners, you may have done the cervical HPV sampling from the vaginal swabs in different kind of settings: rural,
Yeah.
semi-urban, posh clinics, small places, etc. So, right across, has there been any challenge anywhere to do this? And what is the kind of feedback that you get both from the providers and from the women themselves?
Yeah. So, first of all, I like to tell you about the doctors' feedback. The feedback has been absolutely amazing. They are willing to take this because, as I said, there are many patients and fewer doctors in India, and to take this, it requires time, skills, everything. So, they are very happy about it. They are adapting to it. As we are explaining, we are showing them our validations, how results we have obtained, how the comparison have happened. Yes, camps also, we are seeing a far increased number of patients willing for this. They are taking, when once we do the pre-counseling part, they are taking these kids home and, getting it back to us.
Right.
Even in rural setting also, it is becoming very easy because we are providing the information in the local language. So that helps
Right.
them. We have volunteers. We have tried to make it an end-to-end connect, that start to finish, pre to post counseling. We are giving them the idea how the camps are going to be. With Asmita Moment, as you said, this is one of the NGOs we are attached to. We
Yeah.
are going to companies, we are going to schools, we are taking teachers into account. We have gone to army camp, all the wives of army people. We have gone to red light areas, and we have gone and seen some, I mean, surprising results. That these are the centers from where this spread can go anywhere.
Absolutely. And then also, when they take the sample in a remote rural area and it takes a couple of days to reach your green area
Yes,
clinic,
yes, yes, yes.
what does that involve? How much loss of, information could be there, or does it stay for a couple
Yes.
of hours,
So
couple of days, or
yes.
how does that work?
So yeah, this was a very good, evolving process for us, that when we started doing it, it was for 5 days. Then
Mm.
we kept on validating it. Now we are providing a media with the kits. So, it stays, the DNA survives for 15 days. So
Hmm.
we can get the samples from across India. We have gotten from Guwahati to Gujarat and Kashmir to
Oh,
Chennai now.
very
So
nice.
now we are pretty confident about the product, that the DNA survives. We are now trying for 21 days, just in case we want to get samples from globally.
Could they have any challenge at all? Do you sometimes say that no, this sample, ye to nahi chalega. Now you have to send it back again. Because with pap smears, it happens very often. Okay.
Correct,
The
correct,
same
correct.
with the HPV.
Not really, because we get enough amount of material, because the material we require, in a terms of geneticists, it's just 2 microgram DNA we require. So
Mm.
that is enough sample. So far, we have done more than 10,000 cases. We have yet to take a repeat sample. So that is
Ah.
the beauty of DNA, that smallest of cell will give us enough DNA to do the testing.
So the logistical hurdles, even if
Yes,
it takes,
absolutely.
nobody need worry if it takes more than 2 days, for example.
Absolutely.
हाथ में लेके भागने का तो नहीं.
Correct, correct, correct,
So
correct. No,
that's
no,
a good.
these problems are all resolved, and reports can be generated in 24 to 48 hours. So that is been the best part about it.
And do you think still the understanding of the reports and the way forward from there
Yeah.
is a still gap and we need to plug that?
Yes, we need to plug that gap, because see, these genotypes are very new.
Hmm.
So people know about 16 and 18, but rest, WHO had come up with this high risk genotype, which are 14 in number.
Huh.
So the 12 other genotypes are very new. Of course, there are vaccines available for that. So, but yes, there is still updation going on as far as the knowledge about these all 14 high risk types are concerned. And that is why we need to do more of these testing to make people aware that it's not just about 16, 18, but other genotypes also we need to take into account.
See, in India, always our mindset is that we want to offer the best of the test.
Yeah,
But we want to do it at the minimum cost.
absolutely,
ऐसे नहीं
absolutely.
कैसे करें? Quality compromise we don't
Yes,
want to do,
yes, yes,
but
yes.
we want the cost down. But Green Array, to a large extent, has managed that. How did that
Yeah.
happen?
So, as any genetic lab would start, we wanted to do HPV testing. We got a kit from outside India. There were only outside India kits were available. There was no Make in India kit as such when we started it.
Right.
And then, of course, we got it in dollars, converted into rupees, and then the costing jumped up, as you correctly said. So again, and in COVID, it was difficult to get the kits as well. So with my team as geneticists, PhDs, everybody, and we thought, let's just
Explore.
invent. Yeah, let's just explore and make this kit here only in India. We
Wow.
have everything available. We made this kit, started with 16, 18, then added other 12. But we have managed to reduce the cost almost 75% as compared to global kits.
Yeah.
So
And
we have
then,
made sure,
having done this, are there too
yeah.
many regulatory hassles to get these approvals moving?
Yes, yes, there are regulatory hassles. We are in almost, we should get our NABL accreditation for HPV testing. There is CDSCO guidelines for self-sampling. So all these certifications one needs to get. And we just cannot perform testing unless we prove that this has been validated at different levels. We actually tied up with National Institutes also of India and got samples from there, validated our kit. So there was a lot of process. It took us almost a year before we could launch this kit.
That you have managed to just
Yeah.
get on with the Make in India yourself is an amazing,
Yes.
fact which deserves a very, very special applause, not only from me, but right across the listeners as well. Because, when you go deep into things, when you know that it's locally manufactured, there are many parts where, without compromising on quality, you can bring down the cost. And bringing down the cost in terms of the reach of millions of people, that then dream becomes a reality.
Absolutely. And in India, everybody is going to ask the average of Maruti car. So everybody wants a Maruti with features of Mercedes. But we have tried to achieve this. We are very confident that we can compete with any of the global available kits. And this is our Make in India product. We all have to come together and promote it.
Absolutely. That,
Yes.
that we are very, very strongly wanting to do, because we are very proud of the fact that, with the correct focus, that this is the need and this is what is feasible and this is what is affordable. All
Yeah.
the three things are tied in together, because the feasibility also, compared to past, this is so much more easier to do.
Yes.
Affordability, and you already said 75% cost reduction is a huge
Yes.
reduction in itself. So
Absolutely.
that's an amazing,
Yeah.
bit of information that you have given. Is there any flip side to this? Would you think that it needs a lot more comparison? Why are they so expensive? Why are we so? Because the mentality is, if it's so cost effective,
Correct.
cost effective, but
Yes.
somebody may say it is cheap. So
Yeah.
maybe it's not good enough. But we feel that the green heritage are far better, because it's giving us the clarity on all types of HPV that we're exploring.
Absolutely. In India, the biggest challenge what we have seen is that, none of the insurance covers it.
Yeah.
And most of the companies outside, the insurance is one of the biggest factors. And that is why the costing part, nobody thinks about reducing the costing part. But it is with the same ingredients, we can reduce the cost. We have used the same quality ingredients in making this kit. We have not compromised on any its volume. We have validated it in all collection devices. So that way we have not, but we can do that. We have innovators in India who can do anything. So,
Yes, and you're yourself a proof for that, because, with the right intent and a lot of hard work, and you really want to do it, you can do it. That's what the Green Array and you and your team have proved, and we are really so awfully proud of this achievement. Moving further, now we want to do better and better, more and more. Okay,
correct.
Having addressed these critical issues, is there something? See, originally, even when we had to do a glucose test or we had to do a hemoglobin test, take the sample, go to the lab, etc. Now,
Yes.
point of care.
Right.
So, HPV as point of care. Are we exploring that at Green Array?
Absolutely. And this is the first time on a platform I am sharing this news with you and the audience that we are in the process of making a point of care device. We understand that PCR is a big machine and it cannot be present everywhere. And what we can achieve by giving a POCT device to at site testing. So point of care testing, we understand how important it is. We are in the validation stage. We have already validated for type 16.
Mhm.
and we are now validating for 18. So it will be a point of care device which will be kept in all the PHCs and doctor clinics, and will be training the individuals, and it is will be very easy to do the test. The result will be much faster, and same time we can devise a strategy for treatment as well.
Yeah, the FIGO, which is a global organization, has
Right.
a conference coming up at Cape Town. So
Right.
when I was just reviewing one of the late abstract papers, there was a very, very interesting paper on the HPV detection in the urine sample.
Right. Yes.
Yeah, tell us something more about it.
So now we are exploring that whether urine sample, which will make it absolutely non-invasive,
Hmm.
can this also detect HPV DNA? And yes, preliminary results of our study shows that urine sample can be taken as a sample of choice for HPV detection. So we can explore that also. We are also exploring that.
Okay, so that
Yes,
means,
yes. Because as I told you, it's a very limited amount of DNA which is required.
hmm,
So once we get the desired amount of DNA, the testing becomes easier.
yeah.
Yeah.
What is the one myth that people may have about around this HPV issue? Do they think that we are overcalling, we are overdoing, we're doing too much, and it's causing more confusion than ever before? Is that the mindset generally? Mm.
Yes, but biggest mindset I've seen is that people are still failing to correlate cervical cancer with HPV. That
Oh,
cervical cancer is not preventable. This is the common norm. Cancer is not preventable. The cancer first is preventable. One needs to do HPV testing. Now, then, when we come to HPV testing, again, as I said, the myths are that, it is painful. I have to go to a gynecologist. I have to take an appointment, this, that. So there are these many myths and fears which prevent somebody from taking up HPV testing.
yeah, because I think, we did a short survey where, first of all, how many are doing the screening? And we got pathetic numbers, as you yourself
Yes,
have said that, then any kind of screening. That was a general question. Then how many are doing pap smears? Of those who are doing pap smears, how many have shifted to the gold standard HPV testing?
right.
Very, very minuscule. Whereas
Absolutely.
my vision is that those who have never started doing anything, this is, guys, the easiest thing.
Yeah.
And the best thing that you could offer the patient in terms of early detection and preventive care, do the HPV testing. And then what about co-testing? What is your advice on that? If HPV, whatever strain that you have mentioned is positive,
Right.
what next would be also the question. That gap also we have to fill.
True, true. Most of the guidelines suggest HPV testing wherever it is available,
Mhm.
but in low resource settings, still co-testing with LBC or PAP is recommended every 3 years. And one needs to do in positive cases also to know whether there are cellular changes of cancer in that. So these are few of the guidelines which are there for co-testing.
Yeah. See, once upon a time, many, many, many years ago, we were struggling even to have the blood grouping and RH typing of every individual in the country.
Yes,
And many years ago, we also struggled with the universal immunization. So, having crossed all those barriers, do you think the dream of a universal cervical cancer testing with the HPV DNA methodology, maybe the point of care, maybe the urinary sample will become a reality one day? Maybe
I
maybe
certainly
soon, but
hope.
someday.
Yes, absolutely. I certainly hope so. Anything we are seeing, non-communicable diseases are increasing every day. Cancer is one of the topmost disease, and this we can prevent. It
Yes.
must become a universal screening program for women of at least WHO suggests 35 to 45. At least that age one should start.
Excellent. And then also, when you started, no, no, we want to do this, we want to make in India. What were some of the challenges and barriers? Did you fail many times and what happened?
Absolutely. When first of all we tried, procuring the reagents, and this was COVID time. So this the first thing we faced the hurdle there itself,
Hmm,
that how to make it.
hmm,
Once we had made it, then we wanted to validate it, but then to validate also to compare with whom.
hmm.
Still, there is no biobanking or there is storage of sample where one can get a positive sample and we can see it. So that's why it took about 1 year to know all these positive samples. So today, after 3 years, I can say confidently that all 14, I know how much confidence I have now.
Oh, okay, great. So
Yes.
Everything is not easy to as easy as it sounds, but
Yes.
everybody wants to grab the product at the lowest cost. But what is the kind of efforts that has gone
True,
behind
true,
that
true.
is it's a huge challenging task. And then somebody wanting to do it is again yet
Yeah,
another. So
correct.
in the space of greenery, one thing is about the cervical cancer HPV DNA testing, more and more refined and more in depth and more exploratory. Newer things are happening in that space as well. Beyond that, what are the other very futuristic innovative things that you have hit upon? Mm.
So in Green Array, we are now actually in HPV only, we are working on something called integration study.
Mhm,
So how the cancer happens after the HPV infection, we are just starting the new project now
mhm,
that we want to explore exactly how the pathogenesis occurs and how we can detect that.
mhm.
We are working on oncology, we are working on wellness, we are starting with microbiome testing. That is again a new era of health and disease, that all our diseases are related to microbiome.
So
So,
if there are many in the audience who want to connect with Green Array and want to do work
yes.
with you, would you be open to
Absolutely. We are just a
collaborating?
shout away. We are there on social medias. We are on our website, and everybody is most welcome when somebody is in Pune to visit our lab. It's a state of the art lab with all the instrumentation.
Mm.
So, most welcome. We are just a call away.
Excellent. And then this innovative mindset that you have, that you could have as well been in the well established lab doing the same things, because there are volumes for all other tests and then it's business as usual. What motivated you or what prompted you to go beyond this?
So, first thing that motivated us was our founder, Dr. Gupte. So he is one of the person who just
I
keeps
agree.
at us that, how, what are we finding new, what are we, and we have a very good team which keeps exploring different things, that we want to become all make in India tests we want to develop.
Excellent.
So we have realized that costing is going to be the biggest factor with the best of quality, and I think we can easily achieve that. So one after the other, we'll take up the new tests and we'll try to make it in India.
Did you ever look back and feel, oh, but life was going so smooth and now these new things, and then there is so much, because there could have been so many disappointments when something did not work. Okay.
True, true,
So
true.
how do you deal with that mindset? Are you okay with
Yeah, so today morning only I was talking to my wife that, I have a podcast to do now. So, but yes, no, but, finding new things, and when you see these results, you feel validated. Now, when we did this 14 high risk cases,
Hmm,
so we were wondering, yeah, 16, 18 will come, nothing else gonna come. And now we are seeing the results. That,
hmm.
66, 33, all these genotypes are coming. This validates us, in a way that, this validates the team to keep exploring new things,
Yeah.
that we can identify new risks, new modalities. How we can suggest treatment. We are working on oncology in, to suggest a treatment for cancer. So
Hmm.
what gene works for what treatment? So
Ex-
we are working on that. So these are the things, then it motivates us.
I really think the challenges are in itself stepping stone to
Absolutely.
your own inspiration to do more. Because when you
Absolutely.
actually get there,
Yeah.
there is so much pride in when you look back at your own work where nobody else in the country may have
Yeah.
explored that. And then always, I think, sometimes when you have the intent of innovation and we help you in the implementation, it's sure to bring
Exactly.
a
The
very strong
like-minded people,
impact.
like you have always been pushing us for doing, new things. You keep challenging us. Now why not to develop this? Why
Yes.
don't develop this? Now, so these helps us, because then we realize that there is a demand also. So we can provide also. So, all the innovators and like-minded people needs to come together. Everything will be in India, by India, for India.
And
So
one last question about the role that technology plays. See, suppose now in a remote corner, somebody has done, and you come out with a point of care test. So right there, she realizes that yes, this HPV is positive, and this,
yeah,
this, this. So what is the next connect? Through AI, through telemedicine,
correct.
something.
Yeah.
How do you see that happening in future?
Correct. So for these POCT devices, what we are trying to do is that there will be a mothership which will sit in Pune and will gather the data real time from all these POCT devices, and it will be shooting back the reports at the same time. And it will be validated by geneticists by doing telemedicine and AI. So that will be the next step, how we can connect all these devices. Absolutely. So we are working on that as well. Yes.
Excellent. So this is what we call end to end. This is really end
Absolutely.
to end because then it has
Absolutely.
a meaningful finish to this whole, initiative. What is that
Right.
one piece of advice you would like to give to all the new innovators who are now going to come on the scene? Because I'm sure that after hearing the inspiring story of Dr. Sarjan Shah, many of you say, yes, we have this idea or an intent in the mind, but
Yeah.
it has to get into action. So what is your advice to them to
So my advice would be, don't be afraid. If you have an idea, just go for it. People like Dr. Divakar, and there are quite a few people who are there. Don't get disheartened that there is nobody else to, give you a chance to collaborate with you. There are people. So just we all need to come together and do this for India. Yes.
Excellent. So just go for it.
Just go for it.
Just go
Absolutely.
for it.
Rightly said.
And don't be
Yes.
afraid of failures. I think those are two excellent pieces of advice that you've given. And then the strength that you derive from, doing this and getting somewhere and then seeing the scale and the impact. I think nothing else can match that sense of joy and satisfaction, if I may say. So I think.
Absolutely. Absolutely. Even failures will come. I'm not saying it will not come, but eventually you will rise. So this will be there. We have to be at it. That's the spirit.
And also, I think I'm seeing the trend now with institutions like Green Array and then the mindsets like Dr. Sarjan Shah that India may be the first one to lead on many of these things
Oh,
because we
absolutely.
have variety, we have volumes, we have enthusiastic entrepreneurs, and we have strong mind to collaborate and make things happen.
Yeah,
So
absolutely.
with that mindset, at the end of this podcast, I'm very, very hopeful that we have a lot of exciting things to do. So we will stay together on this and do more to make this world a better place. So thank you so much, Dr. Sarjan Shah, for your very valuable time and very deep insights into the hard work that you have done, which has transformed the care to a point where point of care devices can do wonders. Thank you so much.
Yes.
Namaste.
Thank you so much for the opportunity. Thank you.